Good morning, friends. Myself, Dr. Rajiv Paris, Assistant Professor from Arihant Homeopathic Medical College, NRI, Gandhinagar, Gujarat, Swarnim University. Today I am here to present a seminar on the topic Prognosis while approaching chronic diseases. I will be sharing two cases, both of chronic nature, to help you understand how to approach chronic diseases and make their prognosis in a rational manner. So here is the first case. This case was seen by me on 12th of February 2022. The patient is a 79-year-old man who was brought to my clinic by his daughter-in-law at 7 p.m. in the evening. He was a known case of diabetes mellitus type 2 for the last 30 years. Now, what is the complaint he is presenting with? That he is not able to pass urine since last 2 to 3 days. The same morning, before coming to me, he went to another doctor from the village who advised an ultrasonography report which stated that he had prostatomegaly. So on observation, I saw that his lower abdomen was massively distended and he is not able to breathe normally. He is finding it difficult. He complained of stinging pain during micturition. He was able to pass only 2 to 3 drops of urine. He also suffered from fever since the afternoon of the same day. Now, his problems of frequent urinations used to be aggravated at night, that is 12 o'clock midnight to 12:30 a.m. He was able to pass urine only in standing position. In sitting position, he is not able to pass urine. So he is afraid of drinking water since no urination is happening, and also he is afraid of eating food because of the over distension of the abdomen. So what is the probable diagnosis? Acute urine retention secondary to prostatomegaly, revealed on ultrasonography, as well as the three storage symptoms, that is frequency, urgency, and nocturia. Now, this is the complaints of the patient in the chart format. So location, lower urinary system involved in terms of retention, duration, since last 2 to 3 days, stinging pain during micturition, inability to pass urine with fully distended bladder and passes only 3 drops, then there is stoppage, and fever since afternoon. Modalities: worse at night 12 to 12:30 a.m., urination only in standing position, worse in sitting position. Now, what could be the commonest causes of urine retention in males and in females? So, if it is a female, okay, what will be the commonest causes of urine retention? The first cause is the impaired coordination. When do we see impaired coordination? So, impaired coordination in females is specially seen when there is primary bladder neck obstruction, when there is Fowler's syndrome, or when there is detrusor extensor sphincter dyssynergia. Okay, then there can be also perioperative causes, like for example, when there is pain, analgesia, or patient is on anesthetic like an epidural, that will also cause urine retention in female. What are the infective or inflammatory causes of urine retention in female? They can be urinary tract infection, and acute vulvovaginitis, or a herpes, genital herpes. What are the pharmacological causes? Pharmacological causes are when the patient, that is the female patient, is on antidepressants, opiates, antipsychotic drugs, or anti-muscular drugs. Now our patient is a male. So what could be the causes of acute urine retention? First is the enlarged prostate, what we call as the benign prostatic hyperplasia, right, in the elderly people. Now, second cause is the obstructive causes, which are either a urethral stricture or a scar in the bladder neck or renal calculi. Third is the pelvic organ prolapse, which happens in cystocele or ectocele. Fourth is the commonest, that is constipation. Now, what is the fifth? Infection causes could be prostatitis or urethritis or a urethral edema secondary to genital herpes. Now, neurological causes in males could be interruption in the sensory motor innervation of the detrusor muscle, which is seen in cerebrovascular accidents like stroke or in spinal cord injury or in diabetic neuropathy or in multiple sclerosis or in Parkinson's or in Guillain-Barré syndrome. Other cause could also be the muscle dysfunction, like an insufficient detrusor muscle tone, can also cause an acute urinary retention. Now, these are the investigations. The one on the left is the one which is done by the other doctor, village doctor, which shows prostatomegaly with bladder outflow obstruction. And on the right side, this is after 1 month of homeopathy, which it is showing that the post-voidal urine has improved, the size of the prostate has reduced. Now, how we accomplish the improvements? So, the chronic totality has been done with the help of the Boger Boinninghausen repertory. Simple symptoms like first symptom, prostate gland enlarged and swollen. That is the causation. Second, urination drop by drop, that is strangury. Third, micturition interrupted. Now, when you see the drugs which are coming under these rubrics, three drugs are coming outrightly: conium, pulsatilla, and sulfur. Okay, and then staphysagra is also there. Now, from my knowledge of materia medica, the modality can urinate only when standing. Just two drugs are there, conium and sarsaparilla. So, references from conium from our materia medica. If you look at Allen's keynotes, you find great difficulty in voiding urine, okay, and the flow intermits and prostatic affections. If you look in bogus synoptic key, urine stops and starts, better standing, and prostatic dribble, all found in our patient. In Fermulin's concordant materia medica, you find frequent urination at night, feeling of pressure on the bladder, and much difficulty in voiding, dribbling in older men. Now, close coming remedies. We need to differentiate these aspects of our remedies, right? Now, let us take the first one. What is present in our patient uh, to differentiate, which is also present in Sabal cerulata? The first thing is starting flow of urine is difficult and painful. This is there in the drug and in our patient. But what is missing? This patient of our case is not a case of paresis of the bladder sphincter. So Sabal cerulata is eliminated. Then look at pulsatilla. What is present in pulsatilla that is present in our patient? Flow interrupted, right? But if it is pulsatilla, you will have that emotional upset give rise to urinary dribble. This is not the case in our patient. Then why not sarsaparilla? Sarsaparilla, the symptom which is present in our case and in the patient is that can pass urine only when standing. But sarsaparilla has got severe smarting with the last drop or the conclusion of urine. That is not present in our case. So sarsaparilla gets eliminated. Why not staphysagria? See, staphysagria, what is present in our patient and in staphysagria is that urine drop by drop. But what is missing of staphysagria in our patient is burning in urethra when not urinating. So all these drugs are eliminated. So what's the final prescription? Conium maculatum 0/3 was given. 8 drops every hourly. Now, why this potency was selected? See, here we are having an older man with an enlarged prostate and no much characteristics. Hence, LM potency is given in 0 by 3 and every hourly repetition because this is an acute emergency and repetition alone can stimulate a response in this old patient who is having low susceptibility at present. Now, also we have kept a deadline that the patient has to pass urine before 9 a.m. of the next morning. If not, a catheter has to be inserted. So when these terms were agreed upon, the prescription was made. What is his ongoing treatment? He is on anti-diabetic medication and no other remedies. So see the follow-up. Next morning, the follow-up was taken. The patient has got passed urine twice. One is 4.5 hours later, that is 11:30 p.m. on 12th of February. And next morning, that is 5 a.m., he passed 1 liter of urine. So what it shows that the remedy has got registered and therefore now from every hourly we have changed the repetition to 3 times a day. Okay, same conium 0 by 3. 2 days later, he complains of stinging pain that is persisting in the bladder and 5 times he has to urinate at night. At this stage, we did a urine routine test which came out to be normal. No remedy change, no repetition change. Patient is on 3 times a day repetition. Then he came after 3 days and saying that no episode of retention, and we did a PSA to find out whether the other aspects are present. Okay, and PSA is in the normal range, so nothing to worry. So what it shows that susceptibility has improved. Now we change from 3 times a day to every alternate day, right? So this 8th of March, that is 1 month later, nearly 1 month later, we have changed from 3 times a day to alternate day of, and we have stepped up the potency from 0 by 3 to 0 by 6. So these are the reports, the urine routine, and this is the PSA. Here you see 5.89 PSA. Then we see the follow-up after 2 months of the initial prescription. So patient is coming to us saying that I am having a strong smelly urine and more urine at night, frothy urine, gas in the abdomen as a concomitant, and his diabetic values had increased. So here, this is a new symptom. So a new change in totality with regards to diabetes in mind and the concomitant of GIT lycopodium 200, one single dose was given. Then he came after 4 days saying that the urine has become non-odorous and he has to pass urine 7 times at night. So he's better, he's improving, no medication. Then the patient came in the month of May, that is saying that his FBSL is also showing improvement of 96 and no other problems. Now, disease is still lurking. So I have kept him on conium 0 by 6, but I have reduced it to 1 dose per week now for the next 2 weeks. So then the patient came to us after 3 months, that is in the month of August, complaining of fullness in flanks, gas is trapped, feels like inducing vomiting, and better on empty stomach, left eye lacrimation. Now we did a urine routine which showed pus cells 30 to 40, not able to eliminate the stool completely, unsatisfactory stool. Ultrasound was repeated here and it showed grade 2 prostatomegaly. See, after 1 month of treatment when we had done, we found out that he was on grade 1 prostatomegaly. And now after 5 to 6 months when we repeat the ultrasound, it's showing grade 2 prostatomegaly. Patient is angry, scolds his wife when the things are misplaced, and stool is hard. He falls asleep while sitting on the sofa in the morning. So here, what we are having is an acute urine infection. So Nux vomica 10 mg, one single dose was given. So this is in August of 2022. So see, now we have to how to make the prognosis. before prescribing. So first we have to do the staging of the disease, staging of the phase of the disease. So this case is a one-sided disease which is miasmatically irreversible. He is a diabetic with tendency for urinary tract infection annually in the month of August. Urine retention seems to be having pseudomonas infection secondary to prostatomegaly, causing bladder neck outflow obstruction. Now the pace of the disease is slow in nature and psychotic miasm is dominant. So prognosis, internally pathology is advancing from grade 1 to grade 2 of prostatomegaly. This suggests incurability. In the 5 months time period of homeopathic intervention, he did not have any new urinary infection. So symptomatic improvement, but no special relief. So when this happens, three possibilities. Either we are not having the simillimum. Second, check his lifestyle and the home environment. And third can be that the pathologies become extensive, involving one organ. So this case, I will show you the follow-ups of the total 1.5 years. And later on, we found out that the prostate size has gone to 60 cc, which is termed as grade 4 prostatomegaly. Anything above 35 cc is considered a severe form of benign prostate hypertrophy, according to the American Urological Association. So now, considering this staging, this is a miasmatically irreversible disease, one-sided. So layer-wise treatment, that is the Isagaya method, onion peel method. Okay. So we treat the outer layer and slowly proceed inwards to the core. So this is a palliation that we are doing for this type of case. So presently, now, this at a later stage in 2023, there was strong urine infection and pseudomonas, and a surgical intervention was required. Now, see, surgical intervention for this type of diseases is allowed by Hahnemann in the footnote of aphorism 7, where the mechanical obstruction becomes the maintaining cause to the disease. So that has to be mechanically relieved. So a surgical intervention is allowed. So coming to the follow-ups, in 2022, patient came again in the month of October. He can hold urine much longer time now. Now he has eaten beef and at that time he gets hot urine. Even well-cooked food is tasting bland. Now he shared his personal problem at this stage, that his son doesn't listen to him. There is some dispute with the neighbor, and the son is trying to create a illegal road which the father is not in favor of. Okay, so his son is fictitiously creating cases against the landlord, and the patient is unhappy about it. Then the daughter-in-law, she doesn't inform him where she is going, nor she asks him what kind of food he would like to have. So patient is depressed. So a mental disturbance. So Ignatia 1M was given one single dose in the month of October. Then the patient comes to us after so many months. He's coming directly in 2023, that is in the May month. Why he came? Because he has a problem, because he wants to also go in for an eye cataract surgery. But the FBSL is not coming under control, right? So patient is eaten oysters, which are shellfish, and he is complaining of offensive urine, dark colored urine, suggestive of uric acid diathesis, and force of urination is good enough. Okay. So what we gave him, new totality, new symptoms present, benzoic acid, LM1 was given single dose. After this, patient successfully uh, improved, had his eye cataract surgery in June month, and then he was better. So he did not think of coming back for the chronic treatment. Directly, he comes to us in the month of September of 2023, 10th of September. What he is saying? Difficulty in passing urine. Can pass only drops of urine. Urine has become thick and dark yellow. That means there is infection. Then abdomen is tense, both flanks are painful and full. Urine microscopy shows 70 to 80 pus cells, epithelial cells. Only aspect is that there was no fever, but acute cystitis with tender abdomen is present. So now, same symptoms like in the beginning of the case, the same presentation. Prostatomegaly with urine infection and urine retention. So again, I thought of giving him conium in a stepped up potency. So conium 0/9 was given with confidence in a BD. Now this is given on 10 September. 21st of September became 2023, no improvement. So, and Foley's catheter is inserted for a period of 5 days. Culture sensitivity of the urine is done. Pedal edema is observed, that was not improved also with conium. And considering that long-term keeping of Foley's catheter will predispose the patient to further infection, we were trying to convince the patient with the help of the super specialist, that is a urologist, to go for a prostate operation so that to make the life of the patient easy. Why we had to do this? Because pathology is not responding to homeopathic treatment. This was a surprise for the homeopath. But knowing the prognosis that this is a one-sided disease, now the patient has gone into a surgical disease. So we are able to only advise and direct the patient to a urologist and convince him to have this operation. So patient got convinced, and on 7th of October 2023, a transurethral resection of prostate, that is the median lobe, was successfully done. So what's the outcome of case 1? We are able to relieve the outflow obstruction initially, but not able to control the pathology, which is affecting the prognosis of the patient and thus landing up the patient into surgery. Conium maculatum was used to deal with the pathology, but since the patient is psychotic and the age is not in favor of reversal, conium did not help at the end despite being indicated. So this patient did not have much issues of cystitis, nor did not have any issues of comorbidities related to diabetes, because diabetes was under good control. What were the challenges then in this case? The challenges in this case was the poor compliance on the part of the patient due to illiteracy. He was indifferent to recovery. When he's better, he's not showing up for months together. Also, lack of family support, which most of our old patients have to undergo. The home atmosphere and the mood, this adding to the distress of the patient. So you see, environment also affects the prognosis because environment becomes the maintaining factor of the chronic disease. So prognosis in this case started from bad to good, and during follow-ups the indications were clearly present leading to successful outcomes. So a good prognosis was maintained until the time where pathology stopped responding to the medication. Surgical case, it was from the beginning, but with homeopathy, we bought time. He was able to do his cataract surgery without any problem. And now we were also able to keep him comfortable, and patient did extremely well for 1.5 years. But later on, the case was needing a surgical intervention. Now we come to case 2. This is a 40-year-old patient, a teacher by profession. Now I'm sharing with you how her problem started, and patient came to us in 2019 November month, but she is narrating her complaints right from the beginning. So she came to know about her suffering in 2012. Okay. The complaints started suddenly with swelling and boring pains in the knee joints and could not walk. Better by hard massage, better by hot applications. Then in the mornings, right hand would swell, in the evenings, left hand would swell, shifting type of pains. With time, the shoulders got involved, elbows got involved, hurting, and joint problems started all after the first delivery in 2008. Okay, she has a son. Pressing and pulling at the shoulder joint gives her some irritations which ameliorate her in general, and she feels good to be in the heat of the sun. Family history: father is healthy, mother is having hypertension. She was brought up in a middle class Hindu family. She is the youngest of the three sisters. Since childhood, the mother did not treat her well. Because, see, the parents already had two daughters. The third child they were expecting to be a son, but it turned out to be a daughter. So it was in a disappointment. At this time, the father left the house and went away. So the mother kept blaming her and accusing her for father leaving them. Also, when she was in the mother's womb, several attempts were made to abort her, but they were unsuccessful. So, patient, when she came to know about this, she felt unwanted. Mother always hated her, but only after her marriage the mother became nice to her. She speaks and asks God to forgive her mother, but can never forget. Patient is very pessimistic outlook towards life. Before marriage, she was very independent person and took decisions with ease. However, now after marriage, she is fully dependent on her husband and will consult him if she should go for the school picnic. So see the change in the disposition. She confesses that the husband is so cooperative and nice. However, he cannot satisfy her need for love. Now, this love which she is talking about, she is referring to the parental love which she did not receive in her childhood. She always broods for several days if anybody says something to her. She cannot bear any contradiction. She is very emotional person. And in 2016, due to her knees completely destroyed, she was bedridden and no one of her family members came to her rescue. At that time, her mother came to help. The patient likes sympathy from others. She holds grudges but doesn't want revenge. If anyone is in trouble, any of her sisters, she will run to them and help them. She likes to be indoor and wants to clean all the time. Her son tells her that she should join the municipality due to her cleaning talent. At work, in school, she is a perfectionist, never likes to take help from anyone. She is quarrelsome at home, but in school, she is afraid when others are fighting. At that time, she will hide in the toilet. Even when neighbors are fighting, she will hide in the toilet. She has a habit of talking to herself. She feels she is not worth. In 2017, the best orthopedician performed an total knee replacement of both the knees. Before the operation, she took opinion of 12 doctors. Now, presently, the reason for coming to homeopathic treatment is that there is a hairline fracture that is discovered and also there is crackling in the knees. So the same orthopedician who operated her told her that the implants are loosening and that they may have to reoperate. So patient is afraid and she doesn't want to go for an operation. So she wants to try homeopathy and she is confident that homeopathy will help. She feels that she reacts unnecessarily towards her husband, but she says it's beyond my control. She likes to share her problems with her sister and likes to pray to God and sings hymns. Craving for sour things +2, chili patient, findings no contractures, no crackling, wrist swelling present, report RA factor 305 and X-ray shows. So how do we make the prognosis? See, diagnosis of the phase of disease. This is a chronic, fully developed case and miasmatically reversible disease. Now, post total knee replacement surgery, the complication of synovitis is seen in this case of rheumatoid arthritis. Surgery was done. Why? To correct the Panner stage of RA, that is the stage 2, wherein extensive cartilage loss was seen exposing the bones. So what will be our approach? Constitutional approach followed by anti-miasmatic remedy. What's the prognosis? This case required surgical correction. Why? To reconstruct the destruction that was caused by the disease process. This was already done in 2017. At present, just the bone matrix needs to be strengthened. This case stands a good chance of recovery because the susceptibility is good, demonstrated through the clear-cut symptoms that is guiding to the remedy, and the miasmatic load in the family background seems negligible. So chronic totality was framed like this: abandoned feeling, loneliness, unwanted and worthlessness, sensitive, easily offended, leading to anger, brooding, perfectionist, benevolent, spiritual, responsible, industrious, talks to herself, discontented, conscientious, ailments from reserved displeasure and delusion unfit for this world. What's the prescription? In November 24, 2019, Aurum Metallicum 200, one single dose was given. What is the reason for this prescription? The pains are wandering, impelling motion, chronicity of the complaints, ill effects of grief, anger, disappointed love, brooding alternating with irritability, loquacity, rapid questioning without waiting for a reply, fear from least noise. See, these fights are noise. That's why patient was hiding in the toilet. Hateful and quarrelsome. Future looks dark. It means hopelessness and despair. Oversensitive. Every opportunity is sought for self-destruction. And this destruction is happening at the level of the bones. When should we think of aurum? When we see despair, pain, depression that is spreading to the bones in progressive type of diseases, where the patient is wrapped in deep sad thought, suffers from delusion that he has lost the affection of his friends and relatives, and that they have lost confidence in him or her. Aurum patient expects to be respected, understood, and not to be criticized. Holds anger for a long time, tormented by excessive amount of mental suffering. They always believe in giving more to people than expecting and receiving. So let us see the follow-up. Patient was given medicine in November of 2019 and patient come for a follow-up in the March month 22nd of 2020. And she says swelling has reduced 85%, anger has reduced a lot, brooding over trifles is 99% reduced, does not take things to heart, says let them say what they want. Scolding her son every now and then has also reduced. She is focusing on her work. Irritations all the time has reduced completely. Not eating much, but weight gain is there. 69 kilos is her weight. Now she's mixing easily with everyone. Now thermal state has changed from chilly to hot. She's become unorganized, which is visible in her sense of dressing and hairstyle. Right knee has become stiff, difficult descending. Feels something is there. Bad thoughts don't intrude her. Now what has happened? Patient is better, but no new symptom is there. But complementary remedy was given. That is sulfur 200. What is the logic of prescription? In Organon, aphorism 231, 232, Henneman says in non-febrile type of chronic diseases, antisyphilitic is alternated with antisoric. That is aurum alternated with sulfur. Sulfur here is given to strengthen the previous prescription and to prevent relapses. Because also symptoms of sulfur are present, that is unorganized in dressing and hairstyle. Then the patient came to us uh, in the month of June 30th, okay, of 2020, and patient says that swelling appears only at the time of menses. No burping, able to climb stairs without holding support, without holding the railing. So this is progress. Anger subsided, okay, and she got organized in her dressing and hairstyling. So everything is better. So no need of prescription placebo. Next follow-up in the month of October of 2020, where she is complaining of occasional unbearable pain felt in the bones, radiating up from the right knee to the right hip, better by hard pressure. Worse in winter, pain goes on its own. She has to sit on one side, that is one buttock. Swelling is present. So she said that in last 2 months, the swelling that appeared during menses hasn't occurred. Weight 65 kilos. Appetite always feel full. Now here we see the RA factor reading has improved to 89.5 and ESR is 20. So old thoughts do trouble her. Now when you hear old thoughts trouble her, that means return of previous symptoms are coming. The sulfur remedy has got exhausted. So we give aurum metallicum in a higher potency. Aurum metallicum 1 ml, one dose was given mixed in water. Then the patient comes in the next year, that is after 6 months, she comes in the month of February of 2021. And that is 30, and she complains of tiredness on walking, overall heaviness, no swelling during menses, right knee to hip pain has cleared off. She is now traveling on bike. When patient initially started homeopathic treatment, she was brought by in a car by her husband and she was having a limping type of a gait. Now patient has improved and she is traveling to school on a bike with a colleague of hers. So this is progress. Mentally also she has attained a peace of mind. She is eating well. Pickles aggravate her. And she said that even the placebo which was given to her previously got over. And last 17 days she's not on any medication. But she's doing well. She's walking 45 minutes a day every day. So everything is going well in the life of the patient. So no need of any medicine. Placebo was given. Next follow-up in October of 2021. Patient is, see, during COVID, patient is not able to come so often also. That also has to be remembered. Now on 17th October, patient came to inform that she is better without medication for last 3 months. She had 2 episodes of swelling. The first episode was on 30th September of the right hand, and on 6th of October this month, she had of the second episode. And when she got this swelling, she felt like throwing away the part. Now, this is a syphilitic indication. Cannot forgive, has negative thought. Now, say at the mental level also, you are feeling, you are able to see the miasm. Gives a lot of bad words. This never happened in her case, but now she's doing. She's blaming God for punishing her. So why this state came? Because she helped her sister-in-law and that love was not reciprocated. So all these feelings are coming in her mind. Weight 68 kilos. So mental state you can easily see disturbed. So aurum metallicum is given now in a different scale of potency. That is the LM potency 0 by 1. Only one single dose was given. That is in water, mixed in water. Then patient came in the next year, that too nearly after, see, patient has come previously in October of 21. Now she's come in August of 22. So many all months patient was better. So why, what's the reason for the patient to come? She says that in June of 2022, she caught a cold which never improved. And now in August 5th of 2022, it got worse. She was unable to lie down. She was feeling suffocation in the neck. So as if someone is holding her, and she had to be treated with steroids. Too much dry cough, worse on lying down, better sitting up. During cough gets chest pain also, as if muscle are pulled. The spit from the mouth is salty and full mouth is tasting salty. Difficult expectoration, thick and salty expectoration, must sit up, wants windows closed. Expectoration is not sticky. RS was found clear. Now here we are having a acute respiratory complaint which is lingering for 2 months because of mismanagement. Now that salty taste in mouth, salty expectoration, all indicative of CPR 200. CPR 200, one single dose was given. and the problem totally improved. Next prescription, patient has come for the follow-up in May month of 2023. Patient says she had visited Manali, that is a hill station in Himachal Pradesh, no complaints of any sort. In between, she had also gone to Tirupati and done long hours of walking pilgrimage, no complaints. Patient is planning the next trip to Kashmir. Okay, she is eating everything, no troubles. Even after eating pickles, no trouble. And swelling in the knees is coming only 2 days before the menses, and on its own it is improved. So patient is doing very well. So when there are no complaints coming up, why to, what can we do for the patient? So we give a closing dose, that is an antisoric sulfur 1 m. One dose was given. Why? To keep the miasm in latency. So these are the reports which is showing improvement in the RA factor to less than 100, and anti-CCP, which is confirming that this is an autoimmune type of disease which is being treated. So what is the outcome of this case 2? We are having an autoimmune disease with lot of dynamics, which is arising due to conflict at the mental level. How the mind is affecting the body. Mind is the key factor in autoimmunity. Drug has to touch the mind level. Mind becomes the maintaining factor and also alters the whole prognosis. See, surgery was performed for this patient in 2017, but it has not affected the patient in the negative way. No surgical suppression is seen. How can we say this? Because no different forms are coming up after the surgery. Aurum metallicum is so deep enough that it is able to pick up the miasmatic activity with the maintaining factor of the mind, as well as the symptom complex at the body level. That is how the prognosis become positive. Here we are able to deal with the form as well as the structure. Anti-CCP confirms autoimmunity in this case, an improvement of RA factor, which is a prognostic feature, shows how it has improved from 305 to less than 100. Okay, so we are confirming the improvement through the homeopathic intervention. So what is the conclusion? See, in both the chronic cases, we faced advanced pathology. However, in case 1, the patient was 80 years old with a low susceptibility. Hence, he stands a lower chance of cure, so negative prognosis. Therefore, palliative method of therapy was selected for him, and we managed to delay his surgery by 1 year 6 months. Case 2, despite having gone through unavoidable surgery, stood a clear chance of cure because she is 40 years old. I mean, she is a young patient with a good susceptibility and no prominent miasmatic load in the family. So all this adds to a positive prognosis. So prognosis will depend upon the hereditary load of the miasm, the age of the patient, and the remedy response, and also the investigative improvements that are observed. So importance of maintaining factors like the mode of the living and the environmental supporters, all this help in the prognosis of a case. So aphorism 5 is highlighting to us the fundamental cause, that is the miasm. These are the things we have to look for in a chronic case. We have to look for the physical constitution, the moral and the intellectual character. See, in case 1, a illiterate patient. Case 2, a literate teacher, right? The occupation, the mode of the living, and the habits. The old man of a sedentary habit and the teacher who is focusing so much on exercise, every day walking for 45 minutes. Okay, the domestic and social relations, so important. Case 1, lack of family support, lack of dietary nutrition. Case 2, supportive husband, but the initial upbringing years were in so much of rejection environment, lack of love, right? Age of the patient also is to be considered, and the sexual function. So in chronic case receiving, what are our objectives? First is we have to define the problems of the life and living. We must identify the patient's disposition, his attitude, his willpower. See the willpower of the old man, not so much willpower we see. Whereas the lady teacher, she was having a strong willpower. And all these factors have to be ascertained by a skillful interview. Why? Because the root cause may lie in the faulty thinking, the faulty feelings and attitude, or fault might lie in the behavior and action. So all these things have to be known. And also we have to define the therapeutic problem and do the proper homeopathic case management accordingly. Now aphorism 98 tells that what is the demands from the physician: circumspection, tact, knowledge of human nature, that is psychology, and patience in an eminent degree. So the different types of chronic diseases that exist are: one is a fully developed, like our case 2. Second is one-sided disease, like our case 1. Case 1 also later on turned into a surgical disease, that is the third type. Then there are other types of diseases like drug-induced or iatrogenic diseases. And there are diseases which are caused because of mode of living and bad habits. And these become the maintaining factors for the chronic diseases, especially the non-communicable diseases which are on the rise in present times. What are the different approaches for prescribing that are advised in the organon? The first is the PQRS type of prescription. If you have PQRS symptom, then you proceed with the prescribing. If it is not there, then you go for the second type, that is the make the totality and prescribe. Suppose you don't get totality also, then how will you proceed? You go with the state of mind and disposition. That is the third type of prescribe. Suppose if this is also not present, then you will have to make the portrait of the disease and prescribe accordingly. I am open to your queries and suggestions. This is my mobile number, email address. Please feel free to ask your questions and also give me valuable suggestions to improve in future. So I would like to end this seminar by saying a huge thank you to my principal madam of Arihant Homeopathic Medical College and RI. I would like to say a big thank you to Homeopathy 360, who is giving a platform for us young budding homeopaths in propagating homeopathy. Thank you to all the audience for your attentive listening. Thank you to my patients who trust in my work. And thanks to God Almighty. Thanks to Master Samuel Hahnemann and all my teachers. Thank you everyone. Namaste.